And the first block of discussion is myths and misinformation. For various reasons, African Americans equate COVID-19 with previous trials and studies that did not go well with the African American participants. The main one that comes to mind is the Tuskegee Institute. Well, Dr. Lee is from Tuskegee. He'll discuss this and other COVID myths. So, ladies and gentlemen, Dr. Lee.
Hello, everyone. I'm honored to be included in this panel with such an accomplished group of healthcare providers and community leaders. As Al said, my name is Dr. Marvin Lee, and I own a medical aesthetic spa with my wife, Dr. Kenya Lee, in Colorado Springs called Purely Redefined. I'm an internal medicine doctor who's also served in the United States Air Force, and I did my active duty military service right here in Colorado Springs at the Air Force Academy. My experience with COVID has been primarily that of taking care of COVID patients in hospitals in Colorado, both in small rural communities in the western part of the state, but also right here in Colorado Springs and some in Denver. In that role, I have seen a lot of death and suffering. Families all over our state are coping with the unexpected loss of loved ones or adjusting to the needs of loved ones who have survived COVID but emerge unable to care for themselves. On a more personal note, my classmate at Morehouse School of Medicine, class of 1999, who was actually the person who organized my baby shower for my now 23-year-old daughter, died of COVID in 2020. Dr. Jermaine Cummings was an African-American family practice doctor in Metro Atlanta who dedicated her life to helping others and was a dear friend and respected colleague. I myself have been fortunate enough not to contract COVID, but my nephew and my brother both had COVID, and many of my own middle school and high school classmates have actually died of COVID, all from the African-American community. My youngest brother, Daniel, actually participated in one of the COVID vaccine trials because he felt like he understood COVID's impact on our community and wanted to make a difference. Our community in particular rightfully has some reservations concerning accepting the COVID vaccine. And many of these reservations are based in the historical context of our experiences engaging healthcare in this country. Too often our bodies have been misused and taken for granted in order to advance medical science, often with significant delays in realizing the benefits. As Al said, I am in a unique position to speak to a small part of that history. I was raised in the small town of Tuskegee, Alabama, where African-American men with syphilis were told that they were being treated for bad blood, while in fact, they were not being treated, but were being studied in order to learn about the natural history of syphilis. The Tuskegee experience is one of many examples in our country's history of misuse of Black bodies. The famous Dr. Marion Sims, who pioneered many gynecologic surgical procedures, refined his techniques by performing unnecessary gynecologic surgeries on enslaved Black women without anesthesia and without their consent. Furthermore, there is a long history of eugenics in this country, which is the belief that people with certain genetic qualities are more desirable. This belief all too often has led to policies that allowed for the mistreatment of Black bodies, and is often the undercurrent driving some of the inequities we witness in our healthcare system. I am also in the not so unique position of being a Black doctor and therefore complicit, inheriting the professional legacy of this misuse of Black bodies, while at the same time coming from a community which has been marginalized and taken for granted. Navigating these grounds can sometimes be a beautiful struggle, a struggle that many of us on this panel know very well. Many of us on this panel are simultaneously standing on the shoulders of those whose bodies were mistreated, and also standing on the shoulders of those African-American physician pioneers who contributed to science and medicine in great ways. Our community has a long and largely untold history of men and women contributing to medical knowledge and science in general. After all, it was an African-American doctor who successfully performed the first open heart surgery. Another African-American, Dr. Charles Drew, devised the system we use for collecting and storing blood in blood banks. I am here because I believe that this moment is unique in our country's history. The COVID-19 pandemic affects our communities disproportionately for reasons that my colleagues will bring to light. And we are in a unique position to reap the benefits of the COVID vaccine in a timely manner. I believe that this will have a tremendously positive impact on our community. I myself have also received both doses of the COVID vaccine. I made this decision to get the vaccine because I felt that it was the most effective way to protect myself, my family, and my community.